Health Minister Dr Joe Phaahla says at least 4 deaths in Gauteng can be directly linked to the Nehawu strike. The minister visited various health facilities in the province to assess the impact of the mass action on services. Sporadic incidents of violence and intimidation have been witnessed, with patients being blocked from accessing some institutions, in fact patients and healthcare workers. For more on this, we're joined this morning by Dr James van Duuren. He's the Deputy Secretary of the People's Health Movement South Africa. We'll also be in conversation with Section 27. Khanyisa Mapipa will join us once her load shedding issue can be sorted out. But Dr van Duuren, let me welcome you to the program. In fact, let me welcome both of our guests to the program. Great to see you both. Khanyisa, let's kick off the conversation with you. There have been so many reports of violence. We've seen videos doing the rounds on social media. We've heard incidents of an ambulance with a child critically injured in critical care in an ambulance being attacked as well. Dr van Duuren, while we wait for Khanyisa's picture to come to life here this morning, what's your assessment of just how this strike has been conducted?
Well, I think it's important just to first contextualize the fact that the strike comes in the midst of a public health system that is very strained already under years of austerity budgets and increased pressures from the 1990s of the HIV pandemic and then subsequently onto the recent COVID-19 pandemic, where there's a limit of staff shortages, poor infrastructure upkeep, and on this basis, we then get a public sector strike. As the People's Health Movement, which I'm representing today, we understand the value behind strike action as a necessary tool towards arguing for increased wages and increased security and safety of workers. However, it can't be ignored that the right to access to healthcare has been obstructed in this case, with specific incidences, as you point out.
Dr van Duuren, is there any part of you that sympathizes with the plight of workers here, who obviously have very real concerns around their salary and their benefits in the sector?
Certainly, and as the People's Health Movement, again, we fully recognize the fact that a strike with the intention of motivating for the improvement of standards and services in the public sector, including and but not limited to public sector wages, which have stagnated over the past few years, is a priority issue. So definitely there is a sense of sympathy or understanding as to the reasons behind a mass action. But we must point out, as we have in our recent statements, that we must call on the organizations who are behind strike action to make sure that they are monitoring and controlling and calling out those persons or elements that are engaging in activity that is against the Constitution, which includes the obstruction of patient care services, turning away of patients at the gates, closing of facilities, and the damaging of infrastructure.
Yeah. In fact, Mark Haywood, writing quite a powerful piece in response to the strike this week, saying that government is failing our public sector nurses. They should be paying more. But Khanyisa, as we welcome you to the conversation, it cannot come at the cost of patient well-being.
Hi, yes, I definitely agree. That is our position with Section 27, and I share Dr. van Duuren's sentiments when he says, that while there is this right to strike, while these employees or workers have their rights under Section 23 of the Constitution, those rights must be balanced with the rights to access to healthcare under Section 27, and we cannot lose lives at the price of striking workers. There must be a balance that has to be struck, and there are provisions that allow for that balance to be struck, and it just takes government and the unions coming together to make those agreements, so that we don't see a situation where people are not having access to essential services and life-saving services due to a strike.
Yeah, absolutely. Dr. van Duuren, it's such a difficult discussion because the people, and there's been so much discussion and analysis around the fact that these are working class nurses who are protesting, nurses and other healthcare workers who are protesting for better salaries, who are protesting for better working conditions as well. But the irony around the fact that these are working class people, their patients, who are bearing the brunt, arguably, of the strike action.
Yes, certainly. I mean, we know how unequal South Africa's health system is. And we were talking now about a strike in the public sector, which is what 84% of the population rely upon for basic care. And so there certainly is a irony in that, in the fact that it is both the workers in this case who are feeling mistreated by the government, but also as a consequence, the even more vulnerable group, those who are the patients who would suffer in this case. So we think it's important that organizations such as Nehawu, leading the strike, cannot wash their hands of responsibility in controlling those people, or in at least issuing statements and guidance on what sort of activity is included in a successful strike action.
Yeah. Khanyisa, as we talk about, who should be held responsible for the damage being done at various healthcare institutions, for the fact that patients, some of them in need of critical care, being turned away from hospitals. The health minister saying at least 4 deaths just in Gauteng can be directly linked to the strike. What are the next steps here insofar as holding someone accountable for the lives that have been lost at the very least?
Well, so that's, I think, a difficult one to answer, because the strike action, how will respond to say that they are legally protected to hold a strike action, and there is no minimum service agreement between them and the government. So their employees don't essentially need to be at the hospital. Yes, they have a moral duty, as all health workers do, and a legal duty in terms of their employment contract. But they now will argue that this was on their part a lawful strike, although it has all the consequences of a strike. As far as damage to property, the individuals the right to protest does not extend to damaging property, intimidating workers, and that kind of unlawful action. So those individuals who are responsible for that, those individuals can be held liable personally for that action. But in terms of the lives lost, really, like I said, this is a situation that could have been avoided, and that could have been prevented way before it happened. The government and the unions have had ample time to enter into these kind of agreements, especially when it comes to essential services, and they just have not. So in terms of who must bear the blame, I would say that the failure on both sides to ensure the continuation of the service in the event of a legal strike, that is the blame.
Yeah, absolutely. The irony here is that the politicians who are perhaps part of the discussions that should be taking place are not impacted by the strike, Dr. van Duuren. These are people who use private health care. What are the next steps here insofar as what the unions should be doing? And I suppose the answer to that is that they should call off the strike.
Well, I think that it might be a bit more complicated than that, because I think that, as we say, that there are reasons behind this strike action. At the very least, we must call on the unions to make concerted efforts to control the type of activities that are being conducted as part of, if not directly condoned by, at least not disapproved of as part of this strike, because the buck stops really with patient care. And we know, as Section 27 has just pointed out, that the Constitution places limitations upon the right to strike, particularly where it interacts with other rights, such as the right to health care, and specifically Section 27(3), which says that nobody may be denied access to emergency medical care in South Africa. And that's the basis upon which, if people are engaging proactively and productively in the health system, we should be basing our discussion.
Dr. James van Duuren, Khanyisa, Mapipa, let me thank you both for weighing in on this important discussion. And it's certainly a developing story that we're still tracking for you here on the channel. In fact,